He had no complaints like many men who come to my office for an appointment scheduled by their wives. But as I was asking routine questions, he told me that food sometimes catches on the way down. Since this symptom can be an early sign of cancer, I scheduled an EGD to look at his esophagus with a scope. We were both pleased it wasn't cancer, but to find another case of what used to be a very rare disease called eosinophilic esophagitis surprised me. It was the second time I ran into this in the last few years, and I was aware of a few children in town who had also recently had a diagnosis. It was one of those conditions you hear about as a med student, but you never see, except now we're finding much more of it. And this appears to be happening globally. Eosinophilic esophagitis, or EOE, is characterized by an inflammation of the esophagus and the findings under a microscope of many of a special type of white cell called as eosinophil. We've learned this diagnosis can occur in young children to older adults with symptoms of reflux, regurgitation problems, trouble swallowing, and even food catching or getting stuck on the way down. It's interesting how EOE brought specialty groups together. First, the pathologists started seeing more eosinophils on pieces of esophagus biopsied by both pediatric and adult gastroenterologists in patients referred by pediatricians, internists, and family physicians. Since eosinophils can be an indicator of an allergic process, might be, the patients were then sent to an allergist who put it together. We've discovered it's generally related to food allergy or gets better with food allergy treatment. Cow's milk, the most common offender, and is treated by avoidance of the allergenic food or foods, by anti-reflux medicines, and by swallowing a steroid spray that's usually used for asthma. And we're not sure why this formerly rare disease is happening more often now. And currently, there's no accepted theory why EOE is happening more frequently. We generally recommend waiting 4 months to start babies on solid foods and cow's milk. It used to be 6 months for solid foods and 12 for cow's milk. Could EOE have something to do with the timing? Different types of food are introduced to babies? What could be the trigger that draws all those eosinophils to the esophagus? What has changed in our environment to make common something that was a rare disease?